stuff. Is that all right?
We can probably do without it.
That's all, no, we can keep it there if you want, Minister. That's fine.
Sorry?
Is that all right, guys? Yeah, leave it there.
You guys let me know when you're ready to go.
Nice rolling going out. All right, good to go, Minister. You guys good? Yep. Well, thank you.
So in good news, we've had 0 new COVID cases in Queensland over the last 24 hours. This puts us at 6 active cases. And of course, we've had 3,759 tests in the last 24 hours. So thank you to all Queenslanders for continuing to come out and get tested. Of course, those practices we've put in place around social distancing, hygiene, we are asking you to continue those practices, and of course, if you're not feeling well, to stay home, and if you have any symptoms, no matter how mild, we want you to go and get tested and wait for those results. Overnight, of course, we have seen border restrictions being put in place in relation to some of the areas around Western Australia. We in Queensland made that decision based on the advice coming out of Western Australia from the Western Australia Premier and Chief Health Officer, and acting on the advice of the Queensland Chief Health Officer, Dr Young, who indicated that we should equally declare those areas of Perth, Southwest region and Peel region as hotspots. That means that anyone who arrived after 6 p.m. Last night would have to quarantine for up to 14 days. Anyone else who is in Queensland who have been in those areas since the 25th of January, we ask that you go get tested and you and of course, until anyone else coming in would need an exemption from those areas. And if they get an exemption, they will need to quarantine at their own cost in hotel quarantine. We know it's a difficult time for Western Australia. We have been through this recently in Queensland. New Zealand is going through this. We've seen South Australia, Victoria and New South Wales all facing clusters since December. So it's really important that we follow the advice and we act on the best advice that we've got from Western Australia and also Queensland. It is wonderful to be here today at the Prince Charles. We are celebrating 776 new medical interns across the public health system in Queensland. For Metro North, that means 163 new medical interns that will be based here at the Prince Charles, at the RBWH, at the Caboolture and Redcliffe hospitals. And I wish these interns all the best over the next 12 months as they rotate through different areas of the hospital and different areas of specialties to eventually go on to have what I hope is very long careers in the public health system in Queensland. And there are interns all over Queensland who are starting their new roles as doctors right now. So I wish them all the best. Of course, this builds on our record budget this year, over $21 billion across the public health system, across our hospital and health services, and of course our commitment that we made to the people of Queensland to employ 9,475 new doctors, nurses, and ambulance officers and other healthcare workers over the next 4 years. I want to particularly thank the staff here at the Prince Charles who have been on the front line when it comes to responding to COVID. They dealt with one of the first cases off the Ruby Princess. They continue to respond to our positive cases coming out of hotel quarantine and managing them here at the hospital. I've just been talking with some of the staff who manage the PPE, and they were talking about at its peak there were like 8,000 PPE going out the door every day, and they've still got about 600 of that protective equipment going out the door each day to staff across the hospital. And I just want to acknowledge the tremendous work of all of our health workers around Queensland again, and of course especially here at the Prince Charles. I'm happy to ask, and I should say I've got our wonderful local members, Bart Mellish, member for Aspley, and Jimmy Sullivan, member for Stafford, here with us today also. I'm happy to take questions, but we've also got Professor Rowland here who can speak to you, and also one of our interns, Corbin, who's happy to chat. So I might just pass over to the Professor very quickly, and Corbin, and then we'll come back and take questions. If they're still around.
I'm Corbin Evans. I'm a medical intern in general medicine.
Hey, how do you feel first day on the job, and I guess you couldn't get a better start in the middle of a pandemic, or a harder start?
Yeah, I mean, it has been pretty challenging. I think it's challenging every year for all the interns that start. I think fortunately at Prince Charles in particular, I think we're really well supported, not only by our senior colleagues as doctors, but by allied health, pharmacy, and everyone else in the healthcare team.
Does it play on your mind as an intern that I guess ongoing risk of COVID, given that we just had another case in WA?
Yeah, I mean, it's certainly, it's always in the back of your mind. But, I mean, I suppose, it's incumbent on us to be aware of the protocols that are in place at the hospital, and we're fortunate that they're always made readily available to us.
Anything you want to add, Jimmy?
Not particularly.
Thanks, mate.
Cheers.
Thanks, cool.
Professor, would you like to? Sure.
Okay. Hi.
Can you say your name and title for us, Jeff?
My name's Jeffrey Rowland.
Just tell us, obviously, in the middle of the pandemic, what's it like having such a huge cohort coming in? How hard is it to teach them, I guess, or make sure that they're across everything in the middle of a pandemic? Is it a tough challenge?
No, I don't think so. I mean, it's just business as usual. We've been doing this pandemic now for a while. I think we've got it pretty much under control at the moment, at least. So I think it's just a matter of... one thing we've been trying to work on for a long time is getting them to wash their hands. And this helps us push that message, really. So it doesn't really change much at all. It just means that you need to be more careful, you need to be a bit more you need to teach them a little bit more about the way to manage it and so on, but you don't actually need to do a lot of different work. It's actually the same work every day.
And I guess we've got protocols in place for trying to quarantine any sort of people coming back from overseas with COVID. We saw a potential outbreak recently here in Queensland. We've just seen that latest one in WA. Does that play in the back of your mind in terms of, I guess, dealing with this ongoing pandemic?
Yeah, it does. So one of the problems we have is that no two patients are exactly alike, and you come up with various different solutions, and then you've got to constantly be on your feet and your toes to kind of work out what to do. So you'll say that if someone's positive, they've got to be admitted to hospital, even if they're from hospital quarantine, and then you get someone who's not positive but their 5-year-old is, and then do they come with their 5-year-old, or so there's a constant marrying of trying to work out the process for dealing with every different individual. And we've had pretty much, like every week we get a new problem that we have to deal with, but we've managed to deal with every problem as it comes up, and we've managed it very well in Queensland.
And no doubt this pandemic's been draining on health professionals right across the country. When it comes to the public as well, what would your message be to them about, I guess, keeping up that hygiene, keeping up the fight against COVID?
I think the best message is for them to just look overseas, just look at America and England and see how they manage it, and then look at the way we do it. And the way we do it is done right because the people do it right. It's the people doing all the right things and following the message, wearing the masks, staying away from one another, doing all the things that the Chief Health Officer suggests that they do. That's why we're getting through this.
So keep calm, Queensland.
Queensland is they're in the seat. We're in the right place. If we can just get the tourists to come back, we'll be fine.
Thank you. Thanks, Jeff.
Let's go.
Questions?
Minister, where are we up to on the WA, with the WA border? How long is it going to be closed for?
With all of these situations when there's a cluster, what we do is we gather new information every single day. So Western Australia is still in the process of identifying this particular variant for this gentleman who worked in more contagious variants like the UK or the South African variant, that we need to take even stronger measures, and that's why Western Australia has done what they've done, just as we did in Queensland, which is lock down very quickly until they can identify what variant it is, and also, importantly, identify all those close contacts and get them into quarantine and tested as quickly as possible. So we'll be making sure that our Chief Health Officer is liaising with the Western Australia Chief Health Officer daily, and also with the other health officers across the country, just to assess how this is going and seeing where this evolves over the next 5 days, and then of course we can re-evaluate at that point.
So no decision has been made. No decision's been made yet as to how long it'll be.
No, at this stage, what we have said for those who arrived, and there was a flight that came in about 1 o'clock this morning from Perth. There was due to be about 120 passengers on there. I understand there was 47. That got off that plane and went into hotel quarantine last night. There was another small number, I think, that came in via South Australia. So they're all in hotel quarantine. Those people have been told the quarantine will be up to 14 days at this stage, but we will wait for the information coming out of Western Australia to identify when we can lift those restrictions.
At this stage, are you concerned or are you confident that Western Australian authorities have it under control?
There's no doubt that acting quickly is the best advice that we have from the health professionals across this country. That was the advice we got here in Queensland when we identified that we had the UK variant in the community. We acted very quickly. We had a 3-day lockdown, and as we all know, we were able to lift out of our restrictions within 14 days. That was extraordinary, and that was to the great efforts of all the Queenslanders and for giving us that 3 days. So Western Australia has chosen to have a lockdown of 5 days. We'll wait to see what comes forward of their close contacts with their tracing, and also whether they identify whether this is one of the new variants or not.
It must be frustrating to have this outbreak literally the same day or just the night before we were due to bring down our borders. Does that change anything? I know they still come down today, but does it change anything in terms of whether they go back up? Or? Look,
it doesn't change anything in relation to the lifting of restrictions that we did with New South Wales. Of course, we would have all loved to have been standing here today and say there are no hotspots across Australia. But realistically, we know became the Health Minister. As I say, I think a week after becoming Health Minister, we had South Australia. Then we had New South Wales, we've had Queensland, we've had Victoria, we've had New Zealand, and now Western Australia. All of those states thought that we were all on track to have very long periods. In fact, we had reached 100 days of no locally acquired cases. We were all doing very well, but it only takes one case. And we know that it is critical with our hotel quarantine to be doing everything we can to contain it. But we are starting to see in our area, in our region, we are starting to see potential outbreaks out of hotel quarantine, particularly around this more contagious variant.
Regarding that, I was just going to say there was some concerns that that security guard wasn't actually undergoing daily testing, which my understanding was that was meant to be in place for all of Australia after the outbreak we had up here. Have you gone back and checked our hotels to make sure that that is definitely happening?
So we are testing people every shift. So every shift, when people arrive, they're getting testing. They're getting the testing under the tongue, the saliva testing. But in addition to that, every 7 days, they're also getting the full nasal testing. So we believe the regime we've got here in Queensland is the strongest measures we can be taking. I'm not going to comment on Western Australia's processes and what they've been doing, but we know that we have to do everything possible when it comes to hotel quarantine and the people working in hotel quarantine this is a tough job. You know, they're working on the front line with people who are getting off planes, who are coming from countries with very high infection rates. We know that we have to support that staff and those agencies as much as possible to contain this and protect them as well.
Is there any update you can give on the Grand Chancellor investigation?
I expect to get that report this week and hope to be able to release the findings of that report this week.
Have you been given any preliminary information about what's in that report?
Look, I've been given some information, but I really would rather comment when I've got all of the information in front of me and I can tell the public the findings from that report in full.
And Minister, as the former Attorney General, do you think that the state's youth bail laws need to be strengthened?
Look, this is a really challenging area and we're all so sad of what happened last week with the tragic loss of innocent lives, the incidents we are seeing in relation to unlawful motor vehicle use around the state. And I should say that's not just youth. I know there's a lot of discussion about youth justice, but there's plenty of 18, 19, 20-year-olds engaging in these activities as well. We have to take all the advice, the best evidence we can to take the measures we can to reduce this. It is difficult because we are dealing with a small cohort of serious recidivists, particularly in the juvenile space. We are seeing great results in the number of youths not reoffending, a reduction in the number of youths committing offences, but the reality is we do have this small cohort that come from really complex family backgrounds. Some of these youths have been born into a life of crime, abuse, neglect, substance abuse. Certainly that is no excuse for their behaviour. You know, a crime is a crime and there must be consequences to that. But you don't change these sort of youth's behaviour by simply locking up. There's got to be more to it because you have to change what the history of what they've grown up with and that cultural behaviour and that generational poverty and abuse that they've been dealing with. So they are really, really complex issues, and I acknowledge the comments of the Police Commissioner and their frustration. This is a frustration for everyone. We wish we had a simple answer, but the reality is no state, no country has come up with a simple answer of really addressing crime. We can't eradicate crime, but we need to do everything we can to reduce these sort of offences because it endangers the life of the individuals committing these offences and it endangers the life of our police, our frontline workers and of course the community, and we have to do everything possible to reduce those risks.
Just finally on that note, we've heard a lot of talk about remote engine immobilisers and trying to make every car maker install those in the future. You might have had that opportunity to shut the car off given that the 2020 Land Cruiser involved in last week's incident. Have you had any update on that? I know it was taken to National Cabinet nearly 3 years ago. Is there any movement on that? Is that something that you actually like to see so this can stop happening again?
Look, I can say as the former Attorney General, that particular issue was never brought to my attention, but having said that, this is something that would relate to transport ministers. It's a manufacturing issue, it's a police issue. I think we would look at anything that can make our communities safer, but logistically that is a big thing to ask manufacturers, and even if you started that today and said all new vehicles rolling off the production line today would be fitted with this, it's what do you do with every other vehicle out there? So it's one possible initiative, but it doesn't necessarily fix everything overnight. But I know the Minister for Youth Justice will be standing up later today. I know that the Premier has asked the Police Minister and Attorney General and the Minister for Youth Justice to be working together on this to see if there's more that we can be doing to make our community safer.
Okay, thanks guys.
Thank you.
Thanks so much. Minister, I think we have a patient that was some people I have a that was in the room. Just had a quick chat with you.